Hello viewers, welcome to our channel JD Pharmacoveda. In this MRB Pharmacist English test series, we are going to discuss about the test number 14, 15 and 16 together. So first of all, we are very thankful for your support. Keep supporting us, share with your friends and subscribe to our channel. So question number 131. Which of the following is shown on the debit side of trial balance? The options are option A, commission received amount, option B, rent received account, option C, discount allowed account, option D, discount received account. So the right option is option C, discount allowed account. Then question number 132. The process of finding the net amount from the total of debit and credit columns in a ledger is known as. The options are option A, casting, option B, posting, option C, journalizing, option D, balancing. So the right option is option D, balancing. So in a ledger there is debit and credit side, so it has to be balanced when the net amount is go through. Then question number 133. Commercial banks generally provide loans for option A, long period, option B, short period, option C, medium term, option D, installment. So the right option is option A, B, C. Long period. So the repayment period is above 3 years. In next short period means repayment period is less than 1 year. Medium term is repayment period between 1 to 3 years. Then question number 134. In a drugstore, the expiry dated drug formulations are called. The options are option A, dormant materials, option B, surplus items, option C, scrap items, option D, obsolete items. So the right option is option D, obsolete items. Then question number 135. Bedding capacity of large hospitals. The options are option A, 1000 and above, option B, 200 and above, option C, 500 and above, option D, between 800 to 1000. So the right option is option A, 1000 and above. So in the large hospital, their bedding capacity is 1000 and above. Then question number 136. Hathi committee has recommended that IV fluids manufacturing in hospitals should be done under the supervision of a person with dash qualification. Option A, M Pharm, option B, B Pharm, option C, Pharm D, option D, D Pharm. So the right option is option A, M Pharm. Then question number 137. Following are the objectives of procurement of medicines except. The given options are option A, select reliable suppliers, option B, ensure timely delivery, option C, achieve the lowest possible total cost, option D, maximum stock level. So the right option is option D, maximum stock level. So for purchasing the medicine, so our objective should not be for maximizing the stock level. Okay. Then question number 138. Charge and non-charge patient medication comes under dash system. The options are option A, individual prescription order system for inpatient, option B, individual prescription order system for outpatient, option C, the complete floor stock system for inpatient, option D, the complete floor stock system for outpatient. So the right option is option C, the complete floor stock system for inpatient. So this charge and non-charge means, so charge patients means they are admitted as an inpatient. So for their medicine, they have been charged directly from the patient. But for non-charge patient, the nursing department collected the money and through the patient. Then question number 139. Hepatitis B is also called option A infectious hepatitis, option B delta hepatitis, option C serum hepatitis, and option D infectious and delta hepatitis. So the right option is option C serum hepatitis. Then question number 140, polyuria, polyphagia, polydipsia are the symptoms of. So is very easy question. Option A tuberculosis, option B arthritis, option C diabetes, option D ulcer. So the right option is option C diabetes. Then question number 141, which antihypertensive drug can be taken during pregnancy? The options are option A nifedipine, option B propranolol, option C thiazides, option D ACE inhibitors. So the right option is option A nifedipine. So the other drugs or the safety drug during pregnancy are labetalol, hydralazine, and particularly this hydralazine is used as an emergency treatment of preeclampsia. So preeclampsia means high blood pressure in the women after the 20th week of pregnancy. And other drugs are thiazide diuretics and methyl dopa. Methyl dopa can be used as an alternative medicine if other drugs are not used. Then question number 142, any noxious change which is suspected due to a drug occurs at doses normally used in man is called as option A adverse drug reaction, option B drug interactions, option C medication error, option D life threatening reaction. So the right option is option A adverse drug reaction. Then question number 143, theophylline is a option A methylxanthine derivative, option B beta 2 agonist, option C sympatholytic agent, option D parasympatholytic agent. So the right option is option A methylxanthine derivative. So this theophylline is used together with other medicines like etophylline to treat symptoms of asthma, bronchitis, emphysema, and then we discuss about the other options like beta 2 agonist. Examples salbutamol, levosalbutamol, metoprolol, terbutaline, salmeterol, formoterol, and arformoterol. Then sympatholytic agents like clonidine, alpha methyl dopa, and like parasympatholytic agents like atropine, homatropine, tropicamide. Then question number 144, lansoprazole is the option A prostaglandin analog, option B alpha adrenergic agonist, option C carbonic anhydrase inhibitor, option D beta blocker. So the right option is option A prostaglandin analog. So other options like, so this lansoprazole is used to treat glaucoma and other ocular hypertension. Then alpha adrenergic agonist drugs like for alpha 1 agonist phenylephrine, oxymetazoline, alpha 2 agonist like tizanidine, guaifazine. Then carbonic anhydrase inhibitors like acetazolamide and methazolamide. Then beta blockers like atenolol, bisoprolol, labetalol, etc. Then question number 145, which of the following is a prodrug? Option A captopril, option B enalapril, option C hydralazine, option D clonidine. So the right option is option B enalapril. So this enalapril can be converted into an active form enalaprillate. So this question is asked in many type of exams. So just remember, except lisinopril and captopril, all the other ACE inhibitors are prodrug. Then question number 146, pharmacodynamics relates to option A drug elimination, option B drug excretion, option C drug absorption, option D mechanism of action. So the right option is option D mechanism of action. Then question number 147, high efficacious and most commonly used LDL cholesterol lowering HMG-CoA reductase inhibitor. Option A, lovastatin. Option B, simvastatin. Option C, atorvastatin. And option D, pravastatin. So the right option is option C, atorvastatin. So it has high potency with LDL lowering capacity also. Then question number 148. Prolonged use of hydrolyzin therapy is likely to develop. Option A, thrombocytopenia. Option B, hemolytic anemia. Option C, gynecomastia. And option D, lupus erythematosus. So the right option is option B, hemolytic anemia, and option D, lupus erythematosus. So in this, the hydrolyzin can form anti-nuclear antibodies with histone. So histone is a protein which is present in the chromosome. So it can produces the lupus erythematosus, so which is an autoimmune disease. Then question number 149. Which of the following drug may reversibly causes gynecomastia? So gynecomastia means increase in the amount of breast gland tissue in men or boys. So it is due to the imbalance of hormone estrogen and testosterone. The options are option A, omeprazole, option B, pyranozapine, option C, cimetidine, and option D, sucralfate. So the right option is option C, cimetidine. So cimetidine is a H2 blocker drug which can stimulate the prolactin secretion also. So thus it produces reversible gynecomastia. So other options like omeprazole is a proton pump inhibitor, pyranozapine is an M1 muscarinic 1 selective antagonist used to treat peptic ulcer, sucralfate is an ulcer protective drug which act locally in the acid environment with HCl in stomach to form cross-linking or a paste-like material. So thus it protects the intestinal walls. Then question number 150. Which of the following glucocorticoids is a long-acting drug? Option A, prednisolone. Option B, dexamethasone. Option C, triamcinolone. Option D, aldosterone. So the right option is option B, dexamethasone. So it takes 36 to 48 hours of action. Then question number 151. Macrolide antibiotic. Option A, erythromycin. Option B, pilocarpine. Option C, physostigmine. Option D, hyoscine. So the right option is option A, erythromycin. So it is a macrolide antibiotic. So when I study, I used to remember these drugs like ACE. So A means azithromycin, C means clarithromycin, E means erythromycin. So we know that we mostly use that ACE word. So and then pilocarpine is a muscarinic agonist used to treat dry mouth and various ophthalmic conditions like presbyopia. So presbyopia means gradual loss of eye's ability to focus on nearby objects, and it can also used to treat glaucoma also. Then physostigmine is an antidote for anticholinergic poisoning. It acts as a reversible cholinesterase inhibitor to treat glaucoma and myasthenia gravis. Then hyoscine is an antispasmodic drug which is used for the treatment of abdominal pain associated with cramps induced by gastrointestinal spasms. Then question number 152. Influenza antiviral drug is option A, amlodipine, option B, nifedipine, option C, amantadine, option D, felodipine. So the right option is option C, amantadine. So other than that, all the three drugs are calcium channel blockers which are used as an antihypertensive or anti-anginal drugs. Then question number 153. The following are botanical source of Chinchona except option A, Chinchona saxirubra, option B, Chinchona indica, option C, Chinchona calisaya, option D, Chinchona officinalis. The right option is option B, Chinchona indica. Then question number 154. Keller-Killiani test is used to detect option A, digitoxygenin, option B, gitoxygenin, option C, digitoxose, option D decoxygenin. So the right option is option C, digitoxose. So this Keller-Killiani test is an important test used to identify cardiac glycosides and digitoxose. In this test, the solution of glacial acetic acid and ferric chloride is mixed with an extract along with adding concentrated sulfuric acid along the side of test tube. So a deep blue color at the junction is formed. Then question number 155, D-linalool is the main constituent of option A coriander, option B fennel, option C ajovan, option D cardamom. So the right option is option A coriander. So in this type of question, let's learn about its botanical source and family also. For coriander, the source is Coriandrum sativum, family Umbelliferae. For fennel, its main constituent is anethole and fenchone. Its botanical source is Phoeniculum vulgare and its family is Umbelliferae. Then for ajovan, the main constituent is thymol and its source is Trachispermum ummi. Its family is Umbelliferae. Then cardamom, its main constituent is 1,8 cineol and alpha terpineal acetate. Its source is Elateria cardamomum and its family is Zingiberaceae. Then question number 156, aldobionic acid is the main constituent of option A acacia, option B agar, option C Asafoetida and option D Isabgula. So the right option is option D Isabgula. The botanical source of Isabgula is Plantago ovata. Its family is Plantaginaceae. And for acacia, its source is Acacia senegal. Its family is Leguminosae. For agar, its source is Gelidium amansi. Its family is Gelidaceae. And for Asafoetida, its source is Ferula asafoetida or Ferula foetida. Its family is Umbelliferae. Then question number 157, a fruit which is used as a diuretic. So diuretic means it has the ability to increase the urine output. So it is used in pulmonary edema and other edema also. So the fruit, option A fennel, option B amla, option C gogru, option D ajovan. So the right option is option C gogru. So the gogru source is Tribulus terrestris and its family is Zygophyllaceae. And for fennel, we already discussed, its source is Phoeniculum vulgare and family Umbelliferae. Then for amla, its source is Phyllanthus emblica and its family is Euphorbiaceae. Then for ajovan, its source is Trachispermum ummi, its family is Umbelliferae. Then question number 158, indole group of alkaloids present in option A cinchona, option B Naxoamica and Rauwolfia, option C cinnamon and cinchona, option D Vasaga and Ipecac. So the right option is option B Naxoamica and Rauwolfia. So for Naxoamica, its botanical source is Strychnus naxoamica. Its family is Luganaceae. And for Rauwolfia, its botanical source is Rauwolfia serpentina. Its family is Apocynaceae. And then for cinchona, its source is Cinchona calicea, Cinchona ledgeriana, Cinchona officinalis, Cinchona succirubra, and its family is Rubiaceae. Then for cinnamon, its source is Cinnamomum ceylanicum and Cinnamomum cassia. Its family is Lauraceae. Then for Vasaga, its source is Adadoda vesica and its family is Acanthaceae. Then for Ipecac, its botanical source is Cephalis ipecacuana and its family is Rubiaceae. Then question number 159, which one of the following drug belongs to Rubiaceae family? Option A cinchona, option B ergot, option C Naxoamica and option D ephedra. So the right option is option A, Chingona. The other options like ergot, its source is it is obtained from an fungus, and the fungus is grown in a rye plant. So fungus, its source is Claviceps purpurea, and its family is Clavicipitaceae. Then the rye plant source is Secale cerelae, and its family is Poaceae. Then for ephedra, its botanical source is Ephedra gerardiana, and its family is Ephedraceae. Then question number 160. Chrysanthemum cinearifolium is the botanical source of option A, Changpuspi, option B, Satavari, option C, Pyrethrum, and option D, tobacco. So the right option is option C, Pyrethrum. So its source is Chrysanthemum cinearifolium, and its family is Asteraceae. And for Changpuspi, its botanical source is Convolvulus pluricalis option, and its family is Convolvulaceae. And for Satavari, its botanical source is Asparagus racemosus, its family is Aspergaceae. Then for tobacco, its botanical source is Nicotiana tabacum, and its family is Solanaceae. Thank you for watching. If you like our video, please like, enter your thoughts, and any responses related to our video, please enter in our comment section. Share with your friends so they can benefit from that too, and definitely subscribe to our channel.